Good afternoon. I think we'll start getting going here. Thank you very much for coming into this session, which is called Inequality and Power Relations Within Households. My name is Lauren Phillips. I work here at IFAD on policy issues in the Program Management Department. This session is very interesting because what we're going to talk about is approaches to reaching the poor, but within the context of the household. So focusing a bit on gender relations, but also on the way that wealth and assets might be distributed within a household in an imbalanced fashion. So I think it's the sort of looking at the relationships, but also looking at a micro level, perhaps, to this question of rural inequalities. So adding a new flavor to the conversation to date. And I'm very happy to introduce three excellent panelists who are here and going to make small presentations. Dominique van der Walle is the lead economist at the World Bank's Research Department. Her research interests are in the areas of poverty, vulnerability, gender, public policy, and social protection. She holds a PhD in economics from the Australian National University and an MSc from the London School of Economics. And you'll probably be aware of some of her research, but she's worked on a number of publications, including the 1990 World Development Report on Poverty. And then to her left, we have Dr. Cathy Farnworth, who's a social scientist who has a background and experience over numerous years on gender issues in agricultural value chains, climate change adaptation, pro-poor and gender equitable food security and nutrition, and has also experience, which is what we're going to call upon here today, on participatory research methods and household methodologies. She has written numerous peer-reviewed papers as well. And finally, we have my colleague, Pontian, who is the country program officer for IFAD in Uganda since 2006. And prior to that, he worked as the Rural Development Advisor and Decentralization Advisor for the Irish Aid in Uganda, along with the Irish Embassy. And he had previously worked with the government of Uganda. Pontian has an MBA in finance and an MA in development studies. So the structure here will be that I'm going to pass the floor in this direction, and each of these presenters is going to bring to us a slightly different aspect of this question and topic. And I'm going to ask sort of Dominique to focus a bit on the research findings on the topic, whereas Cathy will focus a bit on approaches and methodologies, including household methodologies. And Pontian is going to share some experiences and lessons from his work in the field in Uganda using these approaches. So without further ado, we'll pass to Dominique. Thank you.
Thank you, Lauren. Can you hear me? Okay, so I'm going to talk to you about two types of research. And the first is targeting poor households to reach, well, poor individuals. It's with Martin and Kate Brown. So I think we can all agree that poverty is a deprivation at the individual level, right? But we typically use data for households. We have, that's all the data we have. We really have no individual poverty measures, or very, very rarely. Sorry, can't hear? Sorry. Okay. So individual poverty measures are very rarely available, and so we rely on household level data. We simply make ad hoc assumptions about equality within the household. We take, say, consumption per capita, consumption of the household divided by the number of people in the household, and assume everybody is treated equally inside the household. So that's our poverty measures. Most of our targeting policies are also household-based, and increasingly so. Certainly at the World Bank, there's now talk of subsuming health and nutrition policies within household-based targeted policies. So this means that disadvantaged individuals within the household remain largely invisible in the kinds of data that we typically have. And the question that we wanted to pose in this research is really, how well are we identifying poor individuals by using household-level data? Now, for the reasons I just described, this is a hard thing to look at because there's a missing data issue. We don't have individual poverty measures, so how can we look at this? Well, one clue to individual poverty is nutritional status. And we do have access to a lot of anthropometric data at the individual level. Also, one could argue that this is an important, certainly not the only aspect of poverty, but an important aspect of well-being, and that nutritionally vulnerable women and children have been a very high priority for social policies. There's increasing information on how the impacts of malnutrition on lifelong outcomes for children, and the economic costs and so on. So our key question is essentially, is household level targeting effective at reaching poor individuals as indicated by nutritional status? Now, there's a large literature showing that wealth and nutrition is correlated, right? That the poorer you are, the more likely you are to be malnourished. But there are also a number of other issues that we know that raise doubts about how high that correlation is. The first is heterogeneity in the factors that influence individual poverty and particularly nutrition. And that's really the local health environment, which is going to vary a lot across countries and across regions. Your access to water, sanitation, etc. And we know now also from the literature that this is an area where there are huge externalities and complementarities. So you may be a rich household in an area where the health environment is very poor, but you can protect yourself to some degree with your knowledge, and maybe you have safe water at home and so on. But your children are still going to go play around and with the poor neighborhood children, and may also get worms that prevent absorption of nutrition and so on. So the rich cannot necessarily protect themselves. So that's one issue that's going to vary across households. Another, of course, is intra-household inequality and resource allocations and outcomes. We all know how there's increasing literature showing that this exists, and with terrible implications for women and children often. And there's also literature, and I'm going to talk a little more about that, that shows that there's discrimination within households against certain members. And that can happen in poor households, it can happen in richer households. So this kind of heterogeneity diminishes the scope for reaching poor individuals by targeting poor households. And essentially what we want to ask is, how important is this empirically? Is the wealth effect on individual nutritional status strong enough to allow satisfactory targeting of vulnerable women and children? So we focus on sub-Saharan Africa. We use 30 demographic and health surveys. So that covers 350,000 women. It's women aged 15 to 49. That's the group we have anthropometrics for. And children under 5. We look at BMI and underweight for women. We look at height for age or stunting, and weight for height or wasting for children. To measure living standards of the household, we use the wealth index. The DHS does not collect any data on consumption. And that's a kind of relative measure that ranks households and is constructed based on the household's assets and amenities. Now, of course, lots of you may be thinking, well, the wealth index is a very bad measure of living standards, and consumption would be better. And we do use also, we look at exactly the same thing using LSMS surveys, living standards measurement, consumption surveys that have anthropometric data, that also collect anthropometric data, which is rarer for those surveys. Okay, so we will focus on the bottom 20 and 40% of households based on wealth or consumption. So looking at the data, I'm here showing you 6 countries of this 30. I obviously can't show you all 30. So this is just the beginning of the alphabet. And you see what this shows is the incidence of the 3 anthropometric indices by percentiles of the household wealth distribution. what you see, the top is stunting and followed by wasting, and then I think it's underweight for women of 2 age groups. And what you see is basically, yes, there's a wealthing effect. The poorer households towards the left tend to have higher levels of all those bad things, the bad nutritional outcomes, but it's actually a weak effect. You see that all along the distribution, you have stunted children, you have underweight women, and so on. Okay. Now, the other, we do lots in this paper, but I don't have time to show you much. But here we look at the proportion of the undernourished individuals that are found in the bottom 20% of households by the wealth index and the bottom 40% of households. And if you just focus on the bottom line, which is the mean over the 30 countries, so there's some variance across countries, but really in the end, as the mean shows, it's about 28% of underweight women are found in the bottom 20% of households by wealth, and about 50% of underweight women are found in the bottom 40%. If you look at the children, it's similar. So the general conclusion here is that 3/4 of the underweight men and women and children are not found in the bottom 20%, and about 50% are not found in the bottom 40%. Okay, 2 minutes. So we get very similar results using consumption. The joint probabilities of being poor, given that a woman is underweight or a child is wasted, are close to 0. We add variables to the wealth index, individual, age, education, and so on, and household variables, and find a little improvement, but not much. Okay, so this is my other big concern, the impact of marital shocks on women in Africa. And here, basically, it's other evidence to make my point. It's that within households, we find certain groups that are very disadvantaged. And here I focus on widows and divorcees. And I'm going to control fully for household effects. Okay, so this is really comparing what you have here. Sorry, I am rushing, but this is country-specific effects of widowhood and divorce on underweight for women aged 15 to 49. I'm comparing divorced and widowed women with married women in their first union. Okay, and what I'm showing here is the difference in nutritional status, underweight, between widows and divorcees and married once women, controlling for their individual characteristics and household fixed effects. So I'm essentially comparing women of different marital statuses within the household. The interpretation, so look at Ethiopia, and the blue line, basically, widowhood is associated with a 15 percentage point increase in underweight, controlling for all individual and household characteristics. Okay, what you see is that there are countries where widowhood is a terrible thing for women, high disadvantage in terms of nutrition, and then there are countries where it's actually a better, they're actually better off than married once women. We have explanations for that, but you just see a lot of heterogeneity. You see countries where it's a really terrible disadvantage to have a marital shock. Divorce has lower impacts here. Again, if you look at urban, rural, and there are various things, you get different levels. But I think it's important that you see that across the distribution of income, whether you're poor or wealthy, there's some very disadvantaged women within households. Okay? So the policy conclusions, essentially, household wealth and consumption cannot be used to reliably identify undernourished individuals. Of course, we can't rule out that household level data are more revealing about other non-nutrition dimensions of poverty. We've looked a bit at the role of intra-household inequality, the role of the health environment. Both are definitely playing a role. And I think the big policy issue here is it basically questions, these results question the growing interest in integrating nutrition programs within anti-poverty policies based on targeting poor households. We think that efforts to address undernutrition and, by extension, individual poverty would require much broader coverage rather than being subsumed within household-targeted interventions. Thank you.
Thank you very much, Dominique. I have to say, I read this paper when it came out, and I immediately circulated it to some people within IFAD saying, I think we have a problem here, right? Because we say we're working on nutrition, and we're increasingly trying to have an impact on nutrition through the SDGs and also through our programming. But if we are targeting the poorest, we may not be reaching the nutritional need. And here's an interesting paper which you should read, and you'll see why. So, thank you. And also, I think the findings on variation amongst women and women who are in different circumstances of life is also very important. So we'll pass now to Cathy for her presentation. Yeah, thank you. Can somebody help us change the presentation? Thank you. It's very disempowering to sit here and watch somebody else touching on the screen and not be able to do anything about it. Thanks, Cathy.
Okay, good afternoon. Right, so yesterday we heard a lot about these big institutional failures. We talked a lot about capital and capital movement and financial institutions and how disempowering they can be. And if you remember the presentation from someone from Oxfam, he was talking about can you have democracy, national sovereignty, and so on. And we also heard Violet Shavutzi talking about grassroots women's initiatives. So I'm locating this presentation about household methodologies really at the very bottom and relating back to the discussion we just had on targeting about who is being left behind and how to reach the hard to reach. And also somebody raised a point in the earlier discussion saying sometimes do development agencies and partners make things worse? And I would say, based on my experience, talking to people at the grassroots level, sometimes they do. And just before, to set this presentation in context, just a couple of tiny anecdotes. I just remember being in India with CIMIT, the International Wheat and Maize Improvement Centre, talking to a poor woman. And she said to me, you people are always coming here telling us to change what we do. And where are you when we fail? And for me, that was a very heart-stopping moment because we're not there sometimes. And then in Malawi, I remember some farmers saying, you know, the development agencies are always coming to us, new technologies, new ideas, telling us how to develop. And we get involved, we elect chairs, secretaries, we make a new organization, then they're gone again, and we've only just started. And the third one was in Zimbabwe last year, where I was talking about gender and how important it is to some poor farmers. And this man said, oh, well, if we do this gender thing, will it really change our lives? And I had no answer. But it just made me reflect on how powerless a lot of people feel, also when talking to representatives of development agencies. That unwittingly we can disempower. So household methodologies are a group of planning tools which aim to put poor people into the driving seat. They're not associated with a particular technology. They can be introduced alongside the technology. I think fundamentally for me, it's about empowering people to take choices. You know, they can say, we want that technology, but not that one. And if we have that one, we're going to adapt it like this. And in the context of climate change, this ability to make choices is very, very important. I'm going to talk about gender action learning system. It's one of many household methodologies. I've looked at many across the African continent. Some have been developed by Africans themselves, some by different organizations. So what is GALS? You can find out a lot more by visiting various websites. This is my take on it. It's about thinking. It's a diagnostic and planning methodology. It uses very simple diagramming tools. It's suitable for literate people and also non-literate. It puts people on the same level. It's about acting at the individual level, within households, at the household level, at the community level. You can use it in value chains. Women's empowerment is integral to it. It links into international agreements on how important it is to empower women. It's about benefiting men. And I've looked at gender and agriculture for more than 20 years. And I think unless you include men, these initiatives are really not going to work. And there's a real strong kickback against women's economic empowerment from people in different societies. And I was recently in Tanzania where women said, don't economically empower us. It's not worth it. You know, there's more violence, households break up. We don't want it, which is very disappointing. And the GALS is very useful because it's about peer sharing. People train each other at the village level. And basically, the first step is people develop personal and household level visions. You analyse your current situation and you reflect on your past. But you start with a vision. You think, where do I want to go? So it's not a situation analysis to start with. It's what you want. Then you identify opportunities and constraints that will facilitate the realisation of your vision. So this is really about, this is where all the gender comes in. People think, oh, the way we organise our labour in the household is not working. It's stopping us from getting wealthy or improving our lives. Those are often the constraints. But then if you talk to farmers, they say the opportunities are amazing. We're talking much more to each other. You know, you say, oh, you've got an ox cart. Hi. Can I borrow your ox cart? And then he might say, yes, but can I borrow your panga or something like this? So people start developing relationships and saying, oh, I've got a problem with flooding. Can you help me? So it's all about this level. Step 5, you identify activities you're going to do to reach your vision. And then you set milestones, which are basically indicators. You just say, at the end of 3 months, I will have done this. At the end of 6 months, I will have done this. So this is really what it looks like, in a way. You set your vision first. Then you go back. You think, where are we now? You have your activities and you have your milestones. You look at your opportunities and you look at your challenges. Challenges might be low rainfall, theft, people getting ill. But you look at who you can work with to realise your vision. And there's many tools to diagnose where you are now. These pictures are from Zimbabwe, just a workshop where people are preparing their individual and shared visions. So you can see in the circle, people want cattle, tractors, cars, pigs, improved houses. This is one from Zambia, where people have mapped at the top their opportunities and at the bottom their challenges, and then how they're going to address each of those. This is from Malawi, starting with a very tiny house, going to a big house. There's many analytic tools. These are taken from Zimbabwe and Tanzania, where people, what's really good is they're often called trees, because farmers understand about trees, and they know that a tree needs to be balanced. And if a tree is gender imbalanced, it's not going to grow well. If women are not powerful, the household will not grow. So at the roots, you have the challenges. I could talk for centuries, but I won't. As I said, I think you must get men on board. So this man is saying what he likes and does not like about being a man. And then women say what they like and do not like about being a woman. And often these are very revealing discussions, and these are starting points. I think I won't go into all of this because you're going to talk about... What I want to say is you can reach a lot of people. In Zimbabwe, in 2 years, they reached 25,500 farmers with this methodology. And it cost about $300 per $3 per participant for the whole program. This picture is very important to me. I met this couple. And the man said, he said, you know, before the training, I was a very hard man. I was really tough on my wife. I didn't let her speak. She had no opinions. I was the boss. And my Zimbabwean colleagues talked a lot about him, because when he changed, they were able to build this house. It's still in process. But this is what gender equality can look like. If you work together, you collaborate, it can look like this, a really big house. And it picks up, as I think you know, in a lot of households, you have people developing their own businesses, they're going their own way. You also have collaborative initiatives in households. So GALS, or household methodologies, are strengthening collaboration in the household. It's already there in these societies. It's not new in any way. Just very quickly, this is a married woman with a maize mill that she's bought. The husband would have needed to support her to get that maize mill. The woman on the right was very striking. Her husband had left her like 5 years ago, and she said she was very depressed, and she basically gave up. But she felt empowered as a single woman through this methodology. We need a lot more data on this methodology, but anecdotally, people say all the time productivity increases because people work together on securing inputs. Men, women, and children work together. Everyone works harder because they feel they benefit. And these are what people said. Men said, I used to plough and stop there. I left her all the farm work. After selling, I kept all the money. I didn't buy inputs. And the woman says, everyone used to work on the men's plot, but not the women's plot. I just finished by saying that with CIMMYT was very interested in these methodologies. In 2016, we did a couple of surveys in Malawi looking at the impact of the GALS in one community where they'd done the GALS for, say, 3 years, then a controlled community with no GALS at all. And we looked at the differences in achievement against a number of indicators. And basically, we found that there's much stronger jointness in the households that had adopted the GALS. There's much more labour sharing. There's much more control by women over assets. There's much more dietary diversity in households with higher jointness, much higher. We couldn't prove an increase in productivity, but I think that's because it was a really bad year in Malawi in 2016. We concluded in these two papers, one is still under review, the other one's been published, that GALS can be a climate-smart strategy because it's people are working together. It's enhancing resilience to shocks because people are building assets. They really are. And it catalyzes changes in gender relations in a very short time. Thank you.
Thank you very much. Thank you very much, Cathy. When I see the pictures of the GALS, I always get scared because I have zero artistic talent, so I think I would hate to have to facilitate a workshop where it would be required to draw a tractor. But apart from that, and more seriously, I think GALS is one of the tools that IFAD has used quite extensively and is identified as having a potential to be gender transformative. And I think that the data that you showed about the spread of it across a single country is reassuring, given the discussion in the previous session about how much targeting might cost, right? You said $3 per person, and in a very short period of time, you can reach, tens of thousands of people. So I think that's very interesting to keep in mind. So I'll pass to Pontian now, who I think is going to talk to us about experience in Uganda. Thank you.
Good afternoon. Thank you, Cathy, for laying a good foundation for my presentation. You've elaborated about GALS, and GALS is a key tool in household mentoring. Just as a small background, whereas I'm supposed to just share the experience in the country portfolio, I just want to focus on only one project because we piloted in one project which has closed. We have upscaled in another one which began recently. So I am focusing on one because it's the one we have watched closely and it's the one from which we have drawn lessons. So we'll give an introduction, then how it's done, achievements and outcomes, key success factors, challenges and shortcomings, because it's not a bed of roses. As an introduction, household mentoring to support poor households is a key targeting strategy. It's defined in our Country Strategic Opportunities Plan. I've already mentioned it has been piloted in one project which closed 2 years ago and has just been upscaled. And girls is mainstreamed in household mentoring. How is it done? It is through regular visitation of a mentor to the mentee household. Who is a mentor? These are community-based workers who are selected from the communities. They undergo some specialized training. Among others, they have to go through the girls tour. So you are familiar with training of trainers, but focused on this methodology. So they do regular visitation, like once in 2 weeks, those who can, once in a week, to each household and engage all members of the household. They jointly analyze the reasons for their current status and the potential to improve their well-being. I'm sorry I have not followed the girls' methodology strictly, because they officially, according to girls, you start with the vision and then you come to your current reality. Then they set targets. This is the vision. And then they agree on the steps to take to achieve them. So having set their vision, knowing where they want to go, when it comes to analyzing the reasons for their current status, this is a time of asking questions. Why are we poor? It's not a simple thing to be singled out in a community as the poorest. In some cases, it's a shame. But on the other hand, it can also be a catalyst that once everyone says you are poor, you feel you must do something about it. So when they set targets and they agree on the steps to achieve them, the steps may include doing certain things. Others may also include not doing certain things. What do I mean? When you find that some people are poor, we normally talk about resource endowments. I'm talking from my experience of working with IFAD, but as a person who was born and raised in a rural area, I'm also talking from that experience. I have seen people who have drunk themselves into poverty and finally to death. So if you have agreed on the steps to take, among others, whereas you are supposed to do work, you can also stop drinking. That is not working, but you stop part of what you are doing. And the cycle takes 12 to 24 months. Most of them are normally covered within 12 months, but for the slow ones, a few, you can go up to 2 years. And if you cover 2 years and you have not seen significant change, I think it's time to give up. But we did not get such cases. Now, on how it's done, I have added on another thing. The project had a small package worth $120 as to boost. We used to call it food security grant. It's not part of the household mentoring, but it was a small incentive for those who have done well, a small boost. When it comes to achievements and outcomes, this is the only area where I have figures. Otherwise, I have not been using figures. That is what was achieved, and the project slightly surpassed the target. But when it comes to the actual outcomes, we've seen increased self-esteem and self-worth. What do I mean? Normally when projects are beginning, in the entry processes, there are these village meetings called, and all adults in the village are expected to participate. There are some who don't. And why don't they come? Perhaps they don't have good clothes to put on and be in the public. Perhaps they think if they go there, they will not contribute anything. So their self-esteem is quite low. But once they have gone through this process, their self-esteem increases, and you find them in their usual talk that I can also stand up and talk in front of people. Otherwise, there are some people, if you picked them at random and asked them to say something before a big gathering, you will see them shaking and falling. But once they have gone through this, we see that kind of improvement. The other thing is that the major challenge we have is that members of these households normally do not take part in the mainstream development process. But having undergone the mentoring process, we have seen these members of these poor households joining other development initiatives like farmers groups, functional adult literacy classes, savings and credit cooperatives. Joining these initiatives helps them to access opportunities. At least they can save, they can access credit, and I can say something related to what Ed mentioned some time back. There was a question as to whether some of the interventions of development agencies increase inequality. I have seen some programs, not necessarily by IFAD. I'm not being diplomatic or to IFAD as such. But one of the challenges is that most development projects of a livelihood's nature, they tend to work through groups. I have observed that there are some groups in certain rural areas who have transformed themselves from being target groups into targeting groups. Do I make sense? When we write project documents, in a number of cases you see something called target group. Who are you targeting? But now I'm talking about targeting groups. These groups are so strategic that they have seen opportunities, so they have placed themselves in a position to take advantage of any opportunity that arises. So if you have a program and you have not done thorough analysis, you will support those groups, the individuals in those groups. Once that program is closed, another one starts, they will position themselves and they will benefit from that. So that's why I'm calling them targeting groups. They are targeting development opportunities. However, you cannot be part of that if you are not a member. So once these poor households have undergone through the process, they can join these. Of course, they are not supposed to be targeting, but at least we know that many initiatives target groups. So if you are in a group, the better. If there is a rural finance program, it's interested in circles, you need to be a member of a circle. Then at household level, we have seen significant improvement in sanitation and hygiene, plus general housing conditions. We've seen some who have moved from structures that should not be called houses, but for lack of a better word, they are houses. Some of them are simple huts, and they have transformed and put up permanent structures with burnt bricks and iron roofs. Yes, I have come back to look at sanitation. Yesterday, someone was making a presentation about certain country in Asia and said many people had no latrines. There are some households also that do not have such toilets. And this is not a case of saying it's due to poor resource endowment. What does it take? Digging a pit, getting logs and putting a structure. But it's just a mindset issue. So one of the starting points, even within a month or two, that households start with, those that do not have toilets, they quickly put them up. So we have seen a general improvement in sanitation and hygiene. Then improvement in food security and household income. There is a presentation that Dominique has just made about food security. My own knowledge of certain communities is that we have had cases, like in Uganda, the western region is considered to be the richest. I'm not saying they are very rich like the United States. You know, wealth is relative. But when it comes to nutrition, the highest levels of malnutrition are in that very region. The second in terms of wealth is the central region. But this is related to people's cultures, their diet, the diets and such things. Like we have bananas, a certain variety which they call matoke. It's steamed, cooked and eaten. Scientists tell us it's 80% water and of a very limited nutritional value. But there is a community in central Uganda. If they went to a restaurant and there is no matoke, according to them there is no food, they will leave. Now this is not a question of poverty due to lack of money, but it's just a matter of not understanding the nutritional value. But when it comes to household mentoring, there are simple things that can be done to improve nutrition, like kitchen gardens. And we see improvement there. Then the spirit of self-reliance. A household develops the ability to handle their own issues as an entity. They do not have to rely on others. Whenever they have a challenge, they try to see, given the kind of planning, the vision they have, the interactions they have, how can we sort this as a household? Then a household develops the capacity to discuss sensitive issues together in the household. There are certain things that people rarely talk about, like HIV/AIDS. Like HIV/AIDS, and if one of the parents has that problem, what should happen? So they discuss such things. The last outcome, which is the most important, is improved relations in the household, including gender relations. Because when they are making analysis of their problem, they realize some of the challenges are brought about maybe by only one member of the household working for everyone, and that's the woman. So the key success stories for factors, I will run through this because time is not on my side. Mentoring all adult members of the household together. Unlike groups which look at like maybe one member who is in a group, then use of local and non-volunteers. These community-based facilitators, they are known, and even when the program is gone, they can stay around, they can be arbiters in case of differences. Also, use of the community to identify households. It strengthens targeting. You know that you have actually targeted the poorest since they are arrived at through a wealth ranking exercise. Another one is that some mentored households become role models. They showcase their progress and they are an inspiration to others. In a project, if you have the first batch of mentored households, if they have succeeded, when it comes to the second batch, those who come in are more than eager to join, having seen what has happened to their colleagues. The key challenges, just 3. One is volunteer fatigue. This approach relies on these community-based facilitators, but they also have their own needs. They have households to take care of. So it's a challenge, and the program was providing a small incentive of a bicycle and some little money, $10 per month. $10 is little money, but not everywhere in this world. The second one, we had a few cases of poor identification. In IFAD, we talk about targeting the poorest of the poor. But this approach is suited for the poorest but potentially able. What does this mean? If you find some households where you have like the very sick, the aged, they do not need this methodology. And in some cases, they were selected, but then it was realized you can't move. So they had to be repressed. The other one is a few cases of these households that have been a bit hostile to this. I am poor, leave me alone with my poverty. I know what I will do. You find someone is drunk and he doesn't want to welcome you to his home. The community tries to help, but these are very, very few cases. So these have been the main challenge. So the key conclusion is that household mentoring works, but it needs patience because it takes time. And also you do not cover so many at the same time. And it also needs buy-in, especially of government, to devote a few resources to those household mentors who are not traditional civil servants, and of course the communities which gives the general support. I thank you.
Thank you very much, Pontian. I think there were three things I thought were very important there. The first was on one of the first slides, he mentioned a blended approach where there was also resources that were made available to the families that were participating, which is interesting to discuss. The second that occurred to me, especially as the conference is being hosted by the IOE, is that we need good evaluative qualitative data as well. Right? These findings about people feeling more empowered, we need to document them well, have good data so that we can also make claims beyond perhaps the things we can easily measure with numbers. And I thought that also the problems and challenges were very interesting. So we have just more than 15 minutes, I think, to have some conversation, and there's already a lot of questions. So while I read the questions on the screen, I wanted to invite a colleague up because I know that she wants to share an experience. As all three of the presentations focused on Africa, we thought maybe a colleague could come up and speak to us a little bit about application of the same method in Asia and whether there's any difference. So I'm going to invite my colleague Ans up, and then I noticed a couple of hands in the audience already. So I'll call on you in 1 second to come up. Martin, do you want to come up and join while we're waiting for Ans to speak? No? Okay. Okay. Yes. Okay, go ahead.
Yeah. Thank you very much for the presentations and all the thinking that we had around these household power relations and how it is important to address those power relations, to address inequalities and poverty. I'm just back from a field mission in Bangladesh on Sunday, and on Saturday we had a workshop to share the potential of the gender action learning system with local government and Engineering Development, LGAD, one of the implementing partner of IFAD in the country. And actually this LGAD, the government body, has a gender and development platform. So they were very eager to see how it can address the issues that they were facing. And one of the main challenges that they were sharing is the workload. When they are engaging women in economic opportunities, they are creating jobs for building infrastructures. And they were actually facing the challenge of workload. Women they need to cook and to clean the house before coming to the work. And the work is really labor intensive. So they were looking for options like how to reduce the workload of women, to be economically empowered and to be the part of these job creation opportunities. And they were very happy to see the tools, which are very practical, providing solutions. And what is very insightful also is the tools are based on self-analysis and self-assessment of your own situations, and how do you change that situation to be economically empowered, to be socially empowered. So they create a roadmap for change. They have really milestones and targets, as it was mentioned before. And they can address those issues like, today I'm signing up to a new job. How do I address those inequalities that I have in-house? Workload, decision-making, also the use of income, because what the project noticed is that when women are gaining profits and they save money on the job, the income they are generating, they are inclined to use it for social expenditures, like the practice of dowry. So they invest the money in marrying the daughters. And actually the project is looking for ways to bring them into sustainable livelihoods, so to plan for wealth creation, to plan for increase of income, and to make a good use of the profit that they are making out of this job created. So it has gained the momentum in Bangladesh, and I think now they are really eager to implement the methodology, and we will be able to see the results within a year or even less. So this is Bangladesh, and I have also the chance to discuss with the country team in Nepal, Now they have 2 projects willing to also to uptake the same methodology to really address the power relations within households and really to involve men and women to create wealth first, but to create wealth with gender equality. So for them to agree on what are the changes that we are willing to make to do this wealth creation together, so to collaborate instead of doing their own pathways and not being able to see the complementarity and the complementarity that they can have in doing so. So we will have soon in IFAD, out of IFAD operations, I think results, promising experiences to learn from within a short time period.
Thank you very much. Okay, so we'll add that for the discussion. And I saw Professor Reck there, and then Martin, yes, go ahead.
Thank you. I have 2 small questions for Dominique. From here, I couldn't see. There were 3 charts. There were 3 lines. One was correlating closely with the asset index, and the other 2 were basically flat. So the top one are the children and children.
Yes, stunting.
And the other 2 are women.
So the top one was stunting, usually. The next one was wasting, often, and then it was women of 2 different ages.
Okay.
I mean, taking out the very youngest who are usually...
So the question is, why then there is such a large discrepancy between the first one and the other 2? Then in the case of women, given that we are discussing it in this session, then it may well be that is sheer discrimination. So women, even if you are in a rich household, you starve them. Or it could be due to contextual situation that you mentioned. And so if you have something to mention on that. And the other observation is that what explains Namibia, that I could see, that Namibia, while Ethiopia had a 30% increase in the risk of malnutrition among women in relation to the married women, and I thought that on the right side of the chart, yes, I think it's Namibia.
Yeah,
back.
Yeah. Then, because then actually, if women survive longer by being widowed, then there would be an incentive to the assassination of the husbands. So, what explains that, or is it numerical error?
Yeah.
The one with the graphs, please. Yes.
Should I
Yes.
answer that? Yeah.
Please.
So these are both very general cross-country papers, right? So we've done less work in both papers on understanding why there's differences across countries. In the first case here, I think stunting is the top line, and it's very high in Africa, and you see a more of a wealth effect. In part, stunting is the what is it? Height for age, and it's something that is something that happens very early on because of a shock and so on, and the kids don't recover from, right? So it's a long-term thing. So it's likely to be that the poorer households have a harder time protecting themselves from a very bad drought, protecting the very young child from a very bad drought or some shock early on. Right? Whereas wasting is something that you can recover from, right? It goes up and down with shock. So I think that's what's explaining that. Namibia. Namibia, I don't know actually, but certainly for Mali and for those countries, in some cases, I think that it is so, for Mali, this is the explanation, it is so rare for women to be current widows. There's lots of widowed women, but they remarry, okay? So they get reabsorbed into polygamous households, and hence those that are current widows tend to be women that can afford to live on their own, have a house, have a, education or whatever. So that you tend to find. Namibia, I really don't know. I don't know well enough.
Okay. Let's take another question from the floor then. I think Professor Ravion had a question, and then we'll go to that. And then I saw you over there, sir.
This is to Cathy Farnworth. That picture you had of the couple in front of the new house, I think it was Zimbabwe, very powerful. But tell us, why did that happen? Why did the gender rebalancing within this household lead them to be able to produce this new house, which presumably they wouldn't have otherwise? I can imagine many stories we could tell, but do you know why in this particular case? What was the causal link?
Okay, let's take a couple of questions so that we have a bit more time. The lady behind, and then we'll come over here for questions too.
Hello, my name is Nicolette. I'm from the Office of Evaluation here from IFAD. Thank you, Cathy, for the presentation, and I think it's very interesting because it actually tackles one of the issues that we kind of miss when we look at gender, which is approaches towards including questions on masculinity and what the role of men is in this whole story about household well-being, and also considering that, for example, one of the ideas that Mr. talked about, I don't know, for example, alcohol abuse, etc. These are underlying problems. This is only a symptom, of course, of underlying problems that arise. So I think this approach is very interesting. And my question goes a bit in the same direction. Like, are we talking here about a change or an acknowledgement of the importance of the other person's daily activities? Are we talking about a change in gender roles, or are we really talking about gender responsibility? Because very often when we talk about women's empowerment, we talk about their having increased incomes and reduced drudgery through maybe technology, but never about where are the men when we need them at home, right? So this is my question.
Thank you.
This, actually, I would be even very interested to know what would happen if we would do this kind of approach in our settings and in our world, developed world. So.
Thank you. Okay, I think we have one speaker who's going to come up and ask us a question. Maybe in the meantime, I get your question back there while he's coming up. That's okay.
Everyone's.
Oh, Cheaters wants us all to fishbowl here, so we need to fishbowl. And yes, please. There's a mic just there.
Yes, actually, I have a question, but then they forced me to come here, so it's fine. No, I have a question for Dominique, actually. I know the paper and quite not, I haven't read in detail, but from the presentation, it looks like maybe there is a scope for using, a crazy idea, maybe, I guess you and Martin already thought about that. Maybe using individual level poverty lines, using individual level consumption data. The reason I'm saying that is because we recently have an initiative by the Bill and Melinda Gates Foundation through Tufts University. It's called the International Dietary Data Expansion Project. And it mostly lies in making individual consumption data available. And now they have in the tool, it's also, FAO is also involved in this. It's called GIFT now. It's individual food consumption tool, global individual food consumption tool. And now the surveys are under 62. Of course, there are most of them, if not all, are not nationally representative. But comparing maybe poverty line based on household level food consumption with poverty line individual level, where food consumption is based on individual level, maybe for some promising case studies, maybe not in under 62 countries, maybe it could help us disentangle a little bit household targeting versus poverty targeting, individual targeting.
Thank you. I fear we're going to get overwhelmed with questions, but let's have one more question, and then I'm going to try to group everything together and pass it back to the panelists.
I was wondering the adaptability of the GALS framework to households where multiple generations live together. This comes from a context in which perhaps disempowerment of women, married women, may not necessarily come from their direct relationships with their husband, but also from their in-laws. This is actually, there are some amount of evidence that women who live there with their in-laws may actually face some amount of stress in household decision making, particularly if there is an older woman who is controlling the decisions, the household making decisions. So I was wondering about the adaptability of your framework into household structures like this.
Okay. Thank you very much. Okay, so I think what we'll do is this. So we'll pass to Cathy. She had a number of specific questions for her. And Cathy, when you answer, if you can also see if you can address those two green questions in the middle, which I think are more related to you, which is about youth, incorporating health and youth in household mentoring, and about anthropometric measurements to assess impact. And if you don't, that's okay. We gave you a lot of questions. And then I'll pass to Pontian, and I would ask you to pick up on whatever you would like to comment on, and see if you can also answer the questions in red, which are about IFAD-specific things about M&E and whether we do soft versus hard types of investments. And then I'll finish with Dominique. You had some specific questions from various people, but there's also one question there on separate results for women and children, so I'd like you to try to address that as well. And I apologize to anybody who had their hand up and didn't get a chance to speak. So Cathy, I'll go first to you. Thank you.
I think what really, to come to your question first, I mean, what really strikes me is in these communities there is a lot of money around, more than you might expect. And partly the question is, what is it being spent on? I mean, Pontian talked about alcohol abuse. I mean, in that Zimbabwean context, there's a lot of talk of the smaller house, which means like a mistress. And I don't know how to put this in a reasonable way. It was really interesting because we travelled all around Zimbabwe evaluating this methodology, and basically it comes a lot down to masculinities as well. Men, and it fitted in with gender-based violence. There's a lot of gender-based violence, a lot of spending on other women and misdirection of money, you could say. When they went through the analytical tools as to why this was happening, the man said, we have terrible sex, we have really bad sex with our wives. And this is because there's so much tension about the woman doing so much work and not feeling she's benefiting, and then there's a very bad relationship at the household level. So then the man starts to spend on other women, mistresses. He might go to the market to sell the maize, come back with a new wife. There are a lot of cases of this. And so what happens is, because you go, what's really important is, as I think you said, you go into, it analyzes, these methods allow you to analyze your own situation. It's a generic tool. You can work anywhere. So you see in our context, why do these things happen? Why do we behave in this way and that way? And so once you start to go into the root causes, then you dream up measures for how to address those root causes, and you come up with actions. And then you start to say, but if I didn't spend the money on this, if I didn't spend the money on that, it's also women who are maybe spending money on cosmetics, hairdos, whatever. What could we achieve? And you can achieve a lot with the money that people are already earning. And there's a complementary study, just very briefly, on innovation in value chains. So the colleague I was working with looked up 4 value chains. And there's always women who innovate in these value chains, always, in sesame and mung bean and so on. But those gains are, so women innovate because they want money. And then men take over that innovation, and then women stop collaborating, and so the innovation does not work. So when people pull together, you can achieve huge things. Just on the question of masculinities, I was supposed to be going to Zimbabwe next week because we want to do a study on masculinities and how much society supports these new masculinities. And what about women who have trained their sons in a particular way to be a particular kind of man, and suddenly he's changing nappies, doing the housework, washing dishes? Does society support that? And so you need a critical mass of men who are changing to do this. And we really want to understand more, because I think it's very poorly understood. But you must have quite a lot of men who are changing at the same time and who are unafraid. But these examples, for example, of the big house, it's evidence that if men change, you can achieve a lot. What was the other question?
Cathy, can I ask you to maybe address this question about youth, and also our colleague's question here about intergenerational households, if you don't mind.
Right. Just on youth, I think Pontian can just come to that in a minute. I think generally speaking, youth are not included enough in the GALs, not enough. And I think with intergenerational, it's really, really important to bring everybody in. In Zimbabwe, you can't really do very much unless you get all the in-laws involved. So that's a critical part of it.
Okay. So Pontian, I'll pass to you then.
Okay, thank you. The question on involving youth in household mentoring. The household mentoring approach is inclusive because we have said that they address all adult members of the household. Maybe the usage of the word adult here is what could be confusing. In Uganda, according to the law, an adult is someone who is 18 years, which they call the age of consent. But the way people in the rural areas consider an adult, depending on what the circumstances are. We know that we have children, but we also know that we have big children who are supposed to contribute to household labor, like during school vacation, like from 14 years upwards. Those people also get involved in household methodologies. So the involvement of youth, if they are still members of their parents' households, if they are within that age brackets, they are involved. But they are also youth who are couples, because youth go up to 30, 35. As long as you are one of the poorest households, you will be targeted. The second thing, there is a question as to whether IFAD should reintroduce malnutrition indicators in all projects M&A. Yeah, reflect about it. I think it's okay. I know a number of projects have been asking, depending on the focus. Some say, our focus is on infrastructure. It's not on households. How do you expect us to measure malnutrition? You know, to measure nutrition aspects. But that is something you, the experts on evaluation, that you need to see how it can be handled. Yes, there is this issue of intergenerational members who belong to different generations. Within the same household, yes, they can also be covered. The difference is that given that households do not have exactly the same conditions, so they will not pick up at the same levels. But like if you say there is a senior lady who is a source of problem for the junior lady, at the beginning they may not easily open up. But as the mentoring process goes on, they will open up. We have even seen it in polygamous households where you find that a man has like 2 or 3 wives. And traditionally, you would expect a serious rivalry between the different wives. But with time, they come to realize this is the situation, this is where we are. We may not change it, so rivalry does not help. And they agree on areas where they can cooperate and achieve the household vision.
Excellent. Thank you very much. Okay, Dominique, I'll let you have last word to address this question about girls versus boys and anything else from the audience that you wanted to touch upon.
Thank you, Laurie. We did look at the results separately for boys and girls and found that there, on average, very little difference. So in some countries, one group is more likely to be in the bottom 20 and the other in other countries, but on average, there's really no difference. I think the evidence on Africa is that the kind of male preference is not so much at that level, and there's not so much discrimination against boys at that young age. It's more that the missing women tend to be, adult women. So on your question, Carlo, I'm sorry, I don't really understand what you mean. So do you mean collecting consumption information on each individual? Yeah, it's really a hard thing to do, right? Especially in polygamous households where everybody eats out of the pot. And I suppose that if the data is good, it might be possible, but I think that's very hard. Easier when it's just sort of, 2 parents and children, but very hard in some contexts in Africa.
Yeah, maybe you should look at these under 62 surveys and see.
Yeah.
where data are good enough that we can construct a individual based poverty line. Of course, food poverty line.
Yeah. Dominique, did you? No.
Okay, I think I did a poor job of keeping time at the end, although the presenters did an excellent job of keeping time on their presentation, so thank you very much. There's a number of questions that didn't get answered there. A lot of them have to do with measuring impact, and about GALs in particular, but also about empowerment and transformation, transformational approaches. And I would hope that my colleagues are keeping track of these questions, because I think there's a lot of unanswered ones there, which are important for the conference and for the approach in general. Join me in thanking everyone who asked questions and who participated, but especially our three speakers. And I'm sure we'll get some logistical information about food, when and where, in a second. Thank you very much.
I'll do the logistical.
Thank you.
Just to say that we have lunch where we had lunch yesterday. I was told it's even better than yesterday. So near the executive dining room. We'll probably resume in the next session around 1:40. So thank you.